Hello and welcome. You're watching NewsX and I am Meenakshi Upreti. First of all, I'd like to start today's very special broadcast by wishing all our viewers a very happy International Women's Day. Now, it's a day which comes every year. Every year, we of course wish each other, and that's it. We forget to discuss the core issues which matter to each one of us, issues which are extremely and highly neglected. Why? Perhaps because of the society we are in, and perhaps because women are considered secondary in most conventional Indian setups. What really can we do to bring women's health on the forefront? And what are the issues which affect and afflict our health, and how do we prevent those? What are the lifestyle changes? What is it that we need to improve in our life, be it dietary changes and otherwise? All of that and more we will be discussing in the next 30 minutes or so. I have, of course, the top female doctors from across the national capital associated with one of the best hospitals in our country. I'm going to start introducing them one by one. First of all, Dr. Anuradha Kapoor. She's a senior director and head of unit gynecology from the Max Hospital. Thank you, ma'am, for joining us. Also, Dr. Ramesh Sareen, senior surgical of oncology from the Apollo chain of hospital. We also have Dr. Suman Bhaskar. She's associated with the All India Institute of Medical Science. She's a professor of radiotherapy there. We also have Dr. Daksha Mandania joining us all the way from Nagpur. She's the head of the anesthesia department from the Mandania Cancer Hospital. Very shortly, we will also be joined by Dr. Jyoti Kapoor. She's a psychologist. She'll help us understand really the significance and importance of medical, not just medical, but also mental health issues as far as women are concerned. I'm going to start, first of all, with the gynecologist, the senior gynecologist, Dr. Anuradha Kapoor on our panel. Ma'am, when we speak of women's health issues nowadays, we can divide women into two parts, rural and urban. I'm going to focus today on urban women, urban younger women, say between 30 to 40 years of age, PCOS, thyroid problems, other issues, very, very common these days. On this Women's Health Day, what's the message you'd like to give young girls who are perhaps, afflicted with PCOS, PCOD, thyroid? What is it that they should do? What are the, lifestyle dietary changes perhaps which they can make to control and better their health on their own, first of all?
Thank you, Meenakshi, for inviting me to the panel. Correctly, you said that PCOS is on the rise. So PCOS means that they have irregular cycles, they have acne, they don't have ovulation every month, and they can have androgenic effects like male effects. So the first line of treatment for PCOS patients, which is on the rise, is a lifestyle change. So a lifestyle change means that she has to do regular exercise. So which means about 30 minutes of exercise 5 times a week, which is 150 minutes of moderate pace exercise. The other thing is that she has to do a diet control. So there's no specific diet for PCOS, but it is a calorie restricted diet. So she has to cut out all the junk food, all the burgers, pizzas and maida and white sugar. And she has also obviously to take, nowadays there's a lot of emphasis on micronutrients like myo-inositol and D-inositol. So these are the micronutrients which can also help her. And basically the etiology of this is insulin resistance. That is what causes PCOS. So she has to understand that if she doesn't, just now in the 30s and 40s, the problem that she's having is maybe infertility or irregular cycles or a lot of acne and facial hair, which is giving her low self-esteem. But it is also a disease which can cause a lot of metabolic outcomes later on, like diabetes, increase in cardiovascular disease. And if she doesn't have enough periods, enough cycles in the year, she can also be more predisposed to getting endometrial cancer in the late 60s. So she has to be very, very aware that it is a benign disease, but it's a lifelong disease. There is no cure for it, but you can control it and treat it according to what you desire in your life. In the 30s and 40s, if you need something just to control your cycles, you can get oral contraceptive pills and you can take some myo-inositol and do your lifestyle changes. But in the 40s, if you have diabetes along with irregular cycles, you need to treat that. So it depends. Supposing she has infertility, we need to give her ovulation induction drugs. But lifestyle management is the first line of therapy for
Absolutely.
PCOS.
You rightly said everything is interrelated. You rightly said that everything is interrelated. It is interconnected. Women, of course, can get cancers in the later stages also. It is in this stage that we can change and improve our lifestyle and really change the course of the disease. Dr. Sareen, if you could come in here. When we speak of women and cancer, the first thing which comes to our mind is breast cancer. Fortunately, there is some awareness around it, but there are other cancers also which afflict women. For example, say cervical cancer. About 30% of women in India end up getting cervical cancer. We know that there is vaccination for the same as well. But why is it that there is no awareness around it? And what can we do to increase awareness as far as other cancers other than breast cancers are concerned, ma'am?
Yeah, first of all, I think we should know that, as you rightly said, that cervical cancer, breast cancer, and endometrial gynecological cancers, these are the top cancers that affect females. 60% of the cancers in females belong to these two areas. And fortunately, we have screening methods to diagnose them. Now, there are lots of NGOs doing a lot of good work in causing awareness about vaccination for cervical cancer for the young females, and also for the breast cancer awareness screening methods. But unfortunately, whether women don't come for these awareness lectures, or somehow the lectures don't reach them. I just saw a lady today. She said she has cancer for a month and it had spread to the liver. The liver was completely involved. And I said, don't tell me it's been there for a month. Did you never examine your breast? She says, no, I never examined my breast. And she's 53. I mean, she has no right not to know how to look at her breast at this age. She must see what do they look like. And, when there is a change, she should come to the doctor. But she did not have the lecture reach to her. I do not know what the country can do. Maybe we need to flood things like you are doing, on the TV, so that more people watch, more social media. And so besides this, the gallbladder cancer and the pancreatic cancers are common in females, and the fourth common is the head and mouth cancer. And again, as you realize, the mouth cancer also can be seen. Any ulcer in the mouth lasting for more than 4 to 6 weeks, and especially if it is painless, must be seen by a doctor. So, as you said, we women neglect ourselves, and this is Women's Empowerment Day, and you're doing a great job by causing women to be empowered. And if we have a problem, we should speak up. We should tell, I have this problem. Or you should say, speak up, lady, and say, I need to go to the doctor. I need to get myself checked. So those who have awareness should speak up. And those who don't have awareness should actually start looking programs. There should be more programs like yours. Unfortunately, it's not a high TRP kind of thing. And so the TV doesn't do it more often because you have other pressing needs. But,
Yes, there is
I
no
mean,
doubt,
we
ma'am.
can
We're doing this
prevent
in the
lives.
middle of we're doing this in the middle of elections at a time when it's
Yeah.
Ukraine-Russia crisis, which is completely dominated the news cycle. But it is time that the focus is back. It comes back on women's health, ma'am. And Dr. Bhaskar, would you concur with Dr. Sareen? That till date there is a lack of awareness, even as far as breast cancer is concerned, because it does shock me as an urban woman, because I thought we have so many campaigns around breast cancer. Everyone, if nothing, they know the word mammography. We know that we need to check, touch, and examine our breast. Is that
Right.
something which is still not happening, ma'am, in urban areas as well? And what is it can we do? Because I believe Dr. Sareen is absolutely right. Knowledge is empowerment.
Right.
Dr. Bhaskar, unmute yourself, ma'am. You're on mute. Yes, go
I
ahead.
completely agree with Sareen ma'am. Of course, the awareness is one issue, and the other thing is how to spread this awareness. So, I feel that one is the educated class who can be, easily taught, and they can read and they can Google it and inform and talk about it. Then there is one set of women in our country who are inside their homes and depending on others to speak for them. So these women, especially, they hide away their symptoms. They would shy about these symptoms. They are mentally conditioned to not talk about their problems. So this is one very important category of women who need to be looked at, because they are mostly depending on the men folks. So when a patient is coming, walking into a clinic from that background, So she would say she doesn't know anything, and please talk to the male attendant who's accompanying her. So all these issues also need to be addressed. And secondly, regarding the breast self-examination and other symptoms which can be, caught at earlier stage, these things should start at a very primary level. Maybe, in schools, from school itself, children, young girls can be taught, and all children for that matter across the board can be taught and have some health related education.
Hmm. Well, absolutely. And this is a very important thing, ma'am. You spoke about education from a young age. Now we still have some sex education classes which have started, but even till a few years ago, I mean, I have nephews and nieces who go to, schools and top schools, at least in the national capital, without naming them. But till date, they don't have classes related to, say, menstruation, especially for women, regarding, sex education. Very, very important. And Dr. Mandhania, ma'am, since you're heading the anesthesia department, there is a personal experience, also an anecdote which I can share. So a lot of women, when they are in child, when they're going to bear a child, epidural, that's something which you all give. There is an extreme lack of awareness about it, because I remember I had to ask my gynecologist. I was very pro epidural and I wanted an epidural, but there were many friends of mine who could not make an informed decision whether it's good, bad, ugly. A woman cannot make an informed decision, because be it pregnancy, be it breastfeeding, be it giving birth, a lack of awareness. What is it that we need to do? Would you like to take Dr. Bhaskar's thought forward, ma'am?
Madam, epidural anesthesia can be given in a well organized setup only. I think what's the problem in rural India, especially, is that most of the female practices, most of the gynecologist practices in a nursing homes. But still, what I have seen over 10 years, the epidural anesthesia has got fame, but people are unaware. So it's a duty of doctors also to tell them about epidural anesthesia during their pregnancy only.
Yeah.
And we should make more videos viral on social media to make general public aware about epidural anesthesia, epidural labor analgesia, and its advantages. Many times, females come so late for labor that we cannot give them epidural analgesia. We have to give it during fixed timings.
So I get your point, ma'am. The idea wasn't just to, as far as epidural is concerned, and I know that it's still debated, but at the same time, the question, Dr. Kapoor, you could take this forward, since we were discussing, breast cancer, cervical cancer earlier, and epidural as well. So many issues. I mean, I have about 30 minutes, and I'm going to try and pack as much as I can, but, I'm touching upon all these issues, and all of you experts are saying one common thing: lack of awareness. How do you think, ma'am, we can tackle that? Far as breast cancer is concerned, we all know how to examine our breasts and look for signs of breast cancer. Why is it, do you think, that despite of so many campaigns, online, newspaper advertisements, etc., as well, when we speak especially of, urban India at least, why is there, a lack of awareness, and what we can do? What do you think, ma'am? What would you say today? What the government can do to fight it? I'll come back to you, Dr. Mandhani. I'll take a point from you again.
So see, what we can do at our level is that obviously every patient who comes to us, we have to counsel them and we have to tell them how to examine their breast, to look for any lump in the breast, to look for any dimpling in the breast, any puckering in the skin, any discharge, because sometimes they come to us for abdominal uterine bleeding. So it's not that you have to look at the patient holistically and also examine her breast. Just don't do a PV and PS and pap smear and get away with it. So first of all, we have to counsel all our patients, because with our patient are sitting two other relatives of hers. So all of them will get to know that they have to look out for any breast lump, they have to look out for any kind of dimpling, or any puckering, or any nipple discharge, which is blood stains. So these are the common things. And if they have all this, then they can easily come to the doctor and pick up these things can be picked up early. So this awareness we have to do at our level. And obviously what the government can do is that on the social media, they should have education videos. So, and suppose like now this March 8th is International Women's Day. So they should tell us about the signs and symptoms of breast cancer, which every woman, they should take it out in the newspaper, that these are 5 signs that you should look for: lump, dimpling, puckering of the skin, any redness of the skin, any nipple discharge. These are that will hit everybody if they put it in the newspaper. For cervical cancer, they just have to say 5 things to look out for. That they can say that if there's any kind of bleeding after intercourse, or if there's any postmenopausal bleeding, or if there's any intermenstrual bleeding, or if there's a foul-smelling odor. These are simple, hard-hitting facts which you can just make pointers, and you should just put it out in the newspaper and in the social media. This is what you should do on Women's Day. Empower them,
Yes.
give them information on this.
So, ma'am, since you spoke of certain signs of say cervical
That's
cancers
right.
as well, Dr. Sareen, how common is pap smear in India? Far as I know, it cannot be very common because one, lack of resources, lack of information, education as well, and cervical cancer vaccination. To begin with, many people, just I mean, I barely know any woman, including myself, who actually did get the vaccine because again, we didn't know when to get the vaccine when the time was right. And now, of course, we're much older.
Yeah, right. Actually, you're very right. The cervical cancer, now is more common in the villages, in the rural areas than in the urban areas. And the rural areas, women obviously are not really getting any pap smears done. So I think the urban women also don't get it done, but at least the awareness is there. Now the vaccination awareness is quite a lot, because I think gynecologists are doing fantastic job in creating awareness. So at the rural areas, I think the government had started the examination, and there is something called a visual inspection with an iodine only. I think the gynecologist will be able to tell you. I mean, that seems to have reduced the stage of the disease and has caused more cures. And this can be done at home, at rural primary health centers, and at small clinics, and it's not a difficult one. You don't need to transport the pap smear to a center to look at it. There was a big trial done by the Tata Memorial Hospital in one of the in one of the areas, where they did this versus the other half. But having said that, I think we need both government and corporate and private sector together to fight this cancer,
Yes.
both in the breast and in the cervix and in the mouth.
Governments,
Awareness,
yes,
awareness.
governments, the private sector, of course, even the media, all of us together, ma'am. But Dr. Bhaskar, what
Yes,
about the families? Because
yes.
the families also have a very important role to play, especially post marriage. We've seen it's women who take a very secondary role, be it their nutrition, be it their diet, be it their lifestyle, everything takes a backseat because a woman is so concentrating on raising children, even ensuring that a husband who's perhaps elder than her eats before her. It's quite surprising, at least to someone like me, but it's very common. It's happened in almost every second household I personally know of. What is it that we do right now to change the mentality of the society? I hope the psychologist had joined us, but unfortunately she couldn't. So, Dr. Bhaskar, I'm taking this question from you, ma'am.
So this is the if we look at the larger picture, the society is conditioned in that way that women are, the come at the second position. So it is not an individual's fault as such, but it is what we see, the gender inequality effects which are reflected in these things, in the behaviors and patterns. So it needs addressal at many levels, not only health related matters, but you know uh, education of women, empowering of women, employment, their financial independence. All these factors will contribute to their general well-being. Once a woman is empowered, she will of course be given more respect, and she will herself learn to look after herself. So not in the general society. If you look at our own community, if I talk about the lady doctors, so
Mhm.
it is not just the household responsibilities, it is careers and so many other things, role of a mother at workplace, so many other things. And in the process, health are neglected, for sure.
And it's it is very interesting when I do hear that you have to balance professional and personal life, balance kids as well. I guess the same goes for for a man as well. He also has to balance children and his duties as a husband, but unfortunately nobody thinks or discusses that. But Dr. Mandhania, since you joined us all the way from Nagpur, let's talk a little bit about rural India as well. It's unfortunate, of course, sometimes we as TV journalists also are quite obsessed and focused with the urban population, the younger ones, of course, because they are viewers at the end of the day. But level of information, level of awareness, and of course, the level of significance and importance given to women even lower when it comes to rural areas. Help us understand one, the ground situation, and what you think needs to be done, ma'am.
Madam, first, I think due to social media and easy availability of internet on mobile, little but awareness has increased in rural India also, not up to the mark as urban India. But still, what I feel, we should teach female that they should love themselves. They should take care of themselves. They and the family should also feel that they are equally important part of the family. Whenever they get disease or even they thought of a disease, they think of everything from finance and who will take care of the family or mujhe hi kyo hua. So that should not happen. What we need in rural India is awareness in females and mainly in males, that females are equally important and they deserve equally everything in life.
Hmm. Right. Self realization, very, very important. But when we come to the realm of practicality, Dr. Kapoor, also, what would you like to say today, ma'am? Any tips you'd like to give the viewers? Because, we've come a full 360 degrees. You started with tips when it came to lifestyle management, when it comes to tired, because it's really a culmination and a combination of many factors which end up determining a woman's health in the long term. Be it calcium deficiency, vitamin D deficiency, this is very, very common in India. Arthritis, these are very common diseases, and they can be avoided if we take care of our bodies right from a certain age, isn't it, ma'am?
Yeah. So my message is to all the women, all the beautiful women out there, that give your health a priority. And 5 things that you should look after is your diet, your lifestyle. That means you should do regular exercise every day. You should maintain your body weight and a good BMI index, and stop smoking. Smoking is a cause of a lot of cancers. Decrease your alcohol. And besides teaching your daughters to be strong and healthy, teach your sons to respect women if you want the society to change.
Well, absolutely. That is the right message coming on a day like this. But Dr. Sareen, since we spoke about the significance of regular checkups, the significance of pap smears, etc., what would you like to say? How do you think we can increase awareness regarding the same? And what would you like to tell the women who are watching this telecast, perhaps?
Yeah, I think my message would be speak up, lady. I mean, don't be afraid of talking about your own health, because you are the string of the pearl. If the string is broken, the pearls are all scattered. So it's you are the center of the family. So you should take pride that you are a very important part of the whole family, and that your health is very important. And secondly, I agree with the previous speaker that I think it's the men also needs a lot of awareness, that please respect women, please give them time, give them the priority as regards the health, and other things are needed. But health, um, if health is there, wealth is there, happiness is there, joy is there, bliss is there, everything is there. If your health is not there, you cannot be, the family cannot be happy. So men and women, of course, you should speak up for yourself. Men, please give due respect and due attention to their health. I think they
Right.
need to be taught.
Absolutely. It really is, it's we need to think of each other as a unit, and it's really the men also who need to increase their level of awareness. Dr. Bhaskar, earlier you were speaking about, since we were speaking about the importance and significance of awareness, and that is what these days are all about, ma'am. Help us understand. What do you think the role schools can play, be it at a primary level, secondary level, uh, detecting breast cancer, detecting, of course, even cervical cancer. They're very telltale signs. But the problem is we are barely even aware about menstruation. What role do you think schools can play, especially when it comes to empowering women by the way of educating them about their bodies?
Right.
So definitely, schools can play a very important role in this. The way, if you would remember, there are chapters in the school telling us about deficiency of iron causing anemia and all those things. There can be it can be integrated with the curriculum in the primary school in a simple way where children are made to understand the importance of all these pressing health related issues. And the second important thing is the incidence of smoking in children, which needs to be addressed at school level. So now we are seeing a rise in female smoking, and most of the women start smoking while they are in school.
Hmm.
So this is, and parents, be it parents, be it teachers, be it children, we are not openly willing to accept it or to discuss it. So we need to accept the issue, and then we have to address it as a society, and at the school, from the administration and from the government side as well. We need robust campaigns like we have for pulse polio, and recently we had for COVID vaccine. So we need more robust campaigns to spread awareness.
Well, absolutely rightly said. And the last question to you, Dr. Mandhani, that's, when we are speaking really of increasing awareness about women's health, about women's issues, robust campaigns can certainly go a long way. COVID vaccination is a big example of that, isn't it, ma'am? Be it rural India, there was a lot of hesitation around COVID vaccine, but now we are almost touching 100% double vaccination. We've already given booster doses to almost every second senior citizen in the country. Do you think uh, these campaigns, if they are properly funded by the government, if it really has the backing of the state, the center, the media, it really can make a difference when it comes to women's health as well?
Yes, ma'am. Obviously, if they are funded well, that will make difference. Even the Anganwadi worker can do, I will say, surprises in the campaigns. She can go home to home, she can collect pap smear, she can make people aware about their health. Second thing, what I like, we should also make campaign for every woman, not only rural, urban, working as a senior executive, lower that every woman can't be perfect in every aspect, and that is the thing which is making every woman unhealthy.
Right. These are the aspects which are making women unhealthy, but you couldn't finish your thought there because the network really went off. As we are discussing, Dr. Kapoor, I mean, since we're having some issues with Dr. Manthani, media also, because it's best to end with self critique. We also touch upon issues and seem to forget them. How do you think it can be a sustained program, ma'am?
I think you're doing a very good job. So, but this should be done not once a year. It should be done maybe once a month. So once a month, take up one disease of the woman. Like take up pointers for breast cancer. Like I told you, whether there's a lump or there's a discharge or there's any nipple skin retraction report. Then next month you talk about signs and symptoms of cervical cancer. These are the 5 symptoms. If you have them, please see your gynecologist. So every month, if you do one disease, then it will bring up a lot of awareness among women.
Well, absolutely. As far as the media is concerned, we can touch upon various topics, perhaps monthly. Here on NewsX, of course, we do 3 medical shows a week. But yes, attention did get digressed to COVID when it was the peak, and even when the Omicron variant had risen. Hopefully, we will eventually be able to bring back the conversation about significant topics which need to be discussed on this International Women's Day. The idea was to increase awareness. The idea was to give information, pack in as much information as I can by bringing experts from various fields all across the country. We hope that this show has been as riveting for our viewers, as riveting and informative as it has been for me. For now, I'd like to thank all my experts.
Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.